The ECS, or the endocannabinoid system, is it's an area subject of very intensive research. And this all started about 25 years ago when it was discovered that our brain produces lipid-like molecules that bind to the same cellular receptor that recognizes marijuana or its active constituents THC, and moreover not only binds to these receptors but produces very similar effects. So anybody who smoked pot knows that it causes the munchies, improves appetite. So it wasn't surprising that the endocannabinoids binding to, now I will call these receptors as CB1 or cannabinoid-1 receptor, also promote appetite, and they are part of the neural regulatory network in the brain that is involved in appetite regulation. With this, it occurred to a large pharmaceutical company that if they develop synthetic compounds that would bind and block these receptors, preventing the effect of endocannabinoid, the result would be a decrease in appetite, and that would be a good start for a new medication to treat obesity. So PEA and OEA are structurally related lipids to AEA, but they interact with a different receptor molecule in the cells, and as a result, they have different actions. They are not involved in addictive processes, but this receptor, the PPAR-alpha nuclear receptor, mediates changes in lipid metabolism, and it's also involved in inflammatory and pain processes. Our interest in peripheral CB1 receptor started when the first drug released to the market that blocked CB1 receptor both in the brain and in the periphery, which was called rimonabant, ultimately failed because although it reduced body weight in obese people and also helped improve their other metabolic syndromes, it caused neuropsychiatric side effects, which are due to blocking CB1 receptors in the brain. At that point, it occurred to us that many of the beneficial metabolic effects of rimonabant occur by blocking CB1 receptors in peripheral organs, such as liver, skeletal muscle, the endocrine pancreas, and adipose tissue. So we thought that if one would to alter the structure of rimonabant in a way to reduce its ability to penetrate the blood-brain barrier, that could result in a compound that would retain some or most of the metabolic benefit of rimonabant without its neuropsychiatric liability.